Welcome back. You're watching Center Stage. I'm Bankole Thompson here on WADL TV 38. We just completed our conversation with Dr. Herbert Smiderman of Wayne State University. We're still on the healthcare crisis. Is it healthcare for all or healthcare for some? Joining us, Detroit resident Forrest Smith, a military veteran, who will tell you today he has no health insurance. And we have Alice Benbow from Oakland County, former member, proud member of the Republican Party.
Former activist.
Former activist of the Republican Party. Let's cut to the chase. Let me start with you, Forrest. What do you think about this whole healthcare crisis, where we are, what needs to be done?
Well, it definitely needs to be a situation where everyone can be able to go to the doctor. As a person who has served in the military for this country during times of war, and have brothers who are out there with a similar situation, I think it's ridiculous that it's even a conversation, that there are people actually disrupting meetings, that town hall meetings. This shouldn't even be a question. For me particularly, I've done my part to make sure America stays strong and free. And there's a lot of, the doctor was speaking earlier, talking about the Veteran Administration is a system that could be modeled. The problem with them is they have the limitations on who they can take in. As a reservist, I did a majority of my service as an Army reservist, as a National Guardsman.
Where?
Throughout most time, within the continental U.S. of A. I was activated during the first Desert Storm.
Operation Desert Storm.
I was activated during the first Desert Storm. But there are a lot of men and women, particularly here in Michigan, the Army National Guard, the center over on Grand River. They've done several deployments back and forth. And when they come back, they're not entitled to anything. They're able to be have their medical during the time they're in service. And then if they come back with some types of injuries or things like that, they're allowed continual care. But after a period of time, or when they're out of service altogether, if they've done their 6 years or 8 years or whatever, they're basically just junkie public on the street.
And I'll come to you, Alice, but just I want to explore that further. So what are you doing now? You don't have health insurance.
I don't have health insurance right now, and as I was explaining earlier, in fact, my wife and I, working people, can't get it. My wife is Canadian. I was very fortunate that my son was able to go and do the things necessary. And my son was born in Canada because we didn't have health insurance at the time. My daughter, we had health insurance when she was born, and we had her here in the States. But we ended up going to use the Canadian system because of the ability to my family at that time. And when you're a working family, you can't get on the system. So, I mean, because we made too much money to be considered broke, or to be considered rich or poor. It was just, we were in the middle.
And Canada has come into this discussion because of Michael Moore's movie Sequel, and critics, detractors of the movie said Canada doesn't have, that's not true, but Canada has been shown to be one of the places to have a more sensible healthcare system that takes care of what we call the underclass. But Alice, you're a former member of the Republican Party. What do you make of this conversation for a public option, a universal, a health care to cover the uninsured?
I'm concerned about a lot of the government intrusion with the Obama health care.
Why?
This is a 12-page document dealing with some different things. It talks about the mandating of the page 22 of the health care will mandate the government to audit the books of all employers that self-insure. Talks about health care being rationed on page 29, lines 4 through 16. Talks about the restriction of what doctors will be able to make. Talking about the government having access to bank accounts. It's just a lot of concerns that I have. I also feel like
and I understand that concern, but do you support the public option? Do you support the public option that there are 45 million uninsured in this country, or 47 million, as Dr. Smiderman said, and there are 25 million underinsured who don't have enough money to get health insurance? Do you support the idea that these people need to be taken care of?
I believe that people need to be taken care of, but I don't think really the government should be doing it.
What happened to Medicare? Medicare is working for senior citizens, though.
But a lot of the restrictions that deal with the Obama health care plan, it has a lot of restrictions. They're talking about like people with macular degeneration. They first have to go blind in one eye before the government will actually get them help. There's just concerns about those kinds of issues. I think that what is really sad is that I share with him also dealing with the health care cost. It's atrocious to see the health care business claiming to be non-profit, but then yet it's one of the largest asset holders.
Yeah, but again, then where do you stand, Alice, if it is atrocious for the healthcare to make all this profit while more people are going uninsured, underinsured? Where do you stand here? Do you support the idea that, yes, can we agree that there's a moral issue to have 45 million people in this country with no health insurance, to have 25 million people in this country underinsured? Can you support the idea that something needs to be done to be taken care of, even if it means the government stepping up? Is that not why you pay taxes?
It is the reason why I pay taxes, but I also look at a lot of the systems that are already in place.
Like what?
A lot of the hospitals, like Crittenton Hospital, they have programs there that if you cannot pay for your visit to the hospital, then all you have to do is fill out the paperwork to go ahead and have the hospital take care of it. There's different funds and things that are available for people who don't have insurance.
Well, I can speak to that. The last time I went to the doctor was because I passed out at my job, and I was a rush to emergency, and I went to DMC. And while I was going through, I was there for 3 days, and they also mentioned that you can fill out these papers, this, that, and the other. And I left the hospital feeling better, glad I went. About 6 months later, I found out whatever paperwork that I filled out, signed, or what have you, was not effective. And now I have a bill for over $10,000 for my little 3-day stay. And given the alternative being here and owing $10,000, I'm okay with that. Don't get me wrong. But the reality is, just because they say you can fill out these papers and it's going to go away, somebody's got to get paid, and the money's got to come from somewhere. So if that money, and if there's not benefactors that are doing things at some of these hospitals, there are some benefactors that are writing grants or things to take care of that, or there are government entities that are paying these hospitals. They're trying to get the money through the Medicare, Medicaid systems, or what have you. I, as a man, don't qualify for hardly anything, because men particularly don't qualify for anything in Detroit because we don't fall into the system. So, yeah, I mean, we don't go to the doctor. Men don't go to the doctor anyway, and then you add this to it. Like I said, we get high blood pressure, heart attacks, or whatever. We don't know about it until after we're laid out on the floor somewhere.
So you support a public option? You do support a public option?
Most definitely.
Well, you don't support a public option?
No, I don't. Not as written, and I feel like there's just too much government intrusion, dealing with the banks, dealing with what it's like you got a problem. The insurance companies right now are sitting there and saying, oh, sorry, you have a pre-existing condition, then you can't qualify for insurance. But the government, on the other hand, is going to be doing the same kind of nonsense.
Well, we'll leave it at that, and thank you all for coming on. Alice Benbow and Forrest Smith for coming on the center stage, and Bankole Thompson, you were watching us here inside the studios of AADL TV 38, Detroit's urban TV station. You can read my articles in the Michigan Chronicle newspaper. As always, every week, relevant news and strong views on this program.